Picture this. You open a shed that has been closed all winter. It smells old. Dust floats in the sunlight. In the corner, you see tiny black pellets, mouse droppings. Most people would grab a broom. But what if I told you that one simple sweep could turn invisible dust into something dangerous? Not always, not usually, but sometimes that dust can carry a virus that moves fast, hits hard, and can turn a healthy person's flu-like illness into a medical emergency. Today, we are talking about hantavirus. And by the end of this video, you will know the one cleanup mistake you should never make, the early warning signs you should never ignore, and the myth that makes people feel safe when they are not. Welcome back to Dr. JAMA Explains, where we turn scary health headlines into clear, calm, useful knowledge. This video is for educational purposes only. It is not personal medical advice. If you feel sick after possible rodent exposure, please contact a clinician or your local public health department. Now, here is the promise. By the end, you will not just know what hantavirus is. You will know how to think about it, how to prevent it, and how to explain it to someone you love. Here is the big idea. With hantavirus, the danger is usually not the mouse you see. It is the dust you breathe. Hantaviruses are a family of viruses carried by certain rodents. Infected rodents can shed the virus in their urine, droppings, and saliva. When that dries out, it can mix with dust. If someone stirs up that dust, they may become infected. CDC and Mayo Clinic both describe contaminated rodent material becoming airborne as a key route of infection. That means the risky moment is not always dramatic. It may look like cleaning a garage, opening a cabin, sweeping a barn, moving old boxes, or sleeping in a rodent-infested space. That is why this topic matters. It is not about fear. It is about knowing the one small action that can change the story. What is hantavirus? Let's break it down. Hantavirus is not one single virus. It is a group of related viruses. In the Americas, some hantaviruses can cause hantavirus pulmonary syndrome, or HPS. That means the illness can attack the lungs and heart. CDC describes these two main illness patterns and recommends testing people who have compatible symptoms and possible rodent exposure. In parts of Europe and Asia, other hantaviruses can cause HFRS. That means the illness can affect the kidneys and blood vessels. So, here is the simple version for you. Americas, more lung and heart danger. Europe and Asia, more kidney and blood vessel danger. Worldwide, rodent exposure matters. JAMA's 2025 patient page also emphasizes that symptoms may start at least a week after exposure and can progress to critical breathing problems. Hantavirus illness can feel like a story with two acts. Act 1 may look like a regular viral illness. Marcus is healthy. He has a job, a family, and a shed full of old camping gear. The first symptom is fever. He thinks, gross, I'll clean this fast. So he grabs a broom. Sweep, sweep, sweep. The dust rises. He coughs once, waves it away, and keeps cleaning. 2 weeks later, Marcus feels tired, then feverish, then his legs ache. He thinks, maybe I caught a bug. But then one night, walking from the couch to the kitchen, he feels short of breath. That is the moment the story changes. At the hospital, one question becomes very important. Have you been around rodents, cabins, sheds, barns, or droppings recently? That question can save time. And with hantavirus, time matters. Is not panic if you see mouse droppings. The lesson is, do not dry sweep, do not vacuum, wet it, wait, wipe. We will talk about exactly how in a few minutes. Let's break two big myths right now. Myth number 1. Hantavirus spreads like the common cold. Fact. Most hantaviruses do not spread from person to person. They spread from infected rodents to people. But there is an important exception, Andes virus, which can rarely spread between people after close or prolonged contact. Myth number 2. If I do not see a mouse, I am safe. Fact. you may not see the mouse. The risk can come from dried urine, droppings, saliva, or nesting material left behind. That is why old cabins, sheds, storage rooms, barns, crawl spaces, and garages deserve respect, not fear. Respect. Here is the part of the video that may be the most useful. If you find rodent droppings, urine, or nesting material, do not start by sweeping. Do not start by vacuuming. That can push tiny particles into the air. Instead, think air, wet, wait, wipe, air. Open doors and windows and let the area ventilate. Wet. Spray droppings and nesting material with disinfectant or a bleach solution. Wait. Let it soak. Wipe. Use gloves and wipe it up safely. CDC's cleanup guidance says not to vacuum or sweep rodent droppings, urine, or nesting material. Instead, spray until wet, let it soak, and clean it up while wearing gloves. For heavy infestations, do not be a hero. Get professional help or local public health guidance. And remember, prevention starts before cleanup. Seal holes. Store food in sealed containers. Remove clutter. Use traps safely. Keep rodents out before they move in. Now let's talk about why hantavirus is back in headlines. In May 2026, WHO reported a cruise-associated cluster of hantavirus infections linked to Andes virus. As of the early WHO update, there were confirmed and suspected cases, including deaths, and the investigation was ongoing. ECDC also reported that the broader risk to people in Europe was very low, but that close contacts were being monitored because Andes virus is the hantavirus known for possible person-to-person spread. Most hantaviruses, rodent to human. Andes virus, rodent to human, and rarely person-to-person with close contact. This does not mean hantavirus is suddenly spreading like COVID or the flu. It does not mean people should panic about every public place. Identify the virus, trace contacts, watch for symptoms, protect healthcare workers, find the source, stop further spread. The real update is not that the basic science changed overnight. The update is that the Andes virus exception matters in real life. That one detail changes the entire public health response. Now, let's talk about treatment. What helps? Let's be very clear. For HPS or HCPS, there is no simple home treatment and no magic antiviral pill that reliably fixes it. That may include oxygen, careful fluids, blood pressure support, a breathing machine. Treatment is supportive, which means doctors support the body while the immune system fights. Intensive care unit, ICU care. Sometimes ECMO, a machine that helps support oxygen levels. Dialysis if the kidneys are involved. CDC says there is no specific treatment for HPS, and early intensive care can improve survival. CDC also states ribavirin is not effective for HPS. The core steps are simple. Keep rodents out, clean safely, and seek care early if symptoms appear. Say the words out loud. I may have been exposed to rodent droppings. That sentence can help your healthcare team connect the dots faster. Who should think about hantavirus? Most people with fever do not have hantavirus. Have you had contact with wild rodents or pet rats? Have you traveled to an area where hantavirus is known to occur? Ask. Have you recently cleaned a shed, barn, cabin, crawl space, attic, garage, or storage room? Here is the scary part, but I want to say it calmly. When HPS becomes severe, it can move fast. CDC's Emerging Infectious Diseases reports in 2025 highlighted sole virus infection linked to pet rats and bayou virus cases in Louisiana, reminding clinicians not to make the exposure history too narrow. The right question can change the whole case. Here is your fast recap. Myth 1. Hantavirus spreads like the flu. Fact. Most spread is from rodents. Andes virus is the major person-to-person exception. Myth 2. A mouse bite is the main danger. Fact. Breathing contaminated dust is a major route. Myth 3. If I feel fine after cleaning, I am safe. Fact. Symptoms may appear days to weeks later. Myth 4. Sweeping droppings is fine if I wear a mask. Fact. Do not dry sweep. Wet, wait, and wipe. Myth 5. Hantavirus always starts with breathing trouble. Fact. It often starts with fever, aches, and stomach symptoms. Myth 6. Antibiotics cure hantavirus. Fact. Antibiotics do not kill viruses, though doctors may use them while checking for other causes. Myth 7. Only campers get hantavirus. Fact. Homeowners, cleaners, farmers, travelers, and pet rat owners can be exposed. New vaccine research is promising, but not practice-changing yet. Myth 8. No mouse means no risk. Fact. Old droppings and nesting material can still matter. Myth 9. There is a vaccine everyone can get. Fact. There is no broad, universal vaccine for the public. Myth 10. Prevention is complicated. Fact. The core steps are simple. Keep rodents out, clean safely, and seek care early if symptoms appear. Here is the big lesson. Hantavirus is rare, but rare does not mean impossible. And scary does not mean hopeless. The people who do best are often the people who connect the dots early. The shed, the droppings, the fever, the breathing change. The sentence to the doctor, I may have had rodent exposure. That is why we make these videos, because one clear explanation can protect a family, change a decision, or help someone get care sooner. If this helped you, subscribe to Dr. Shama Explains. Hit the notification bell, like this video, and share it with someone who has a garage, cabin, shed, barn, storage unit, or camping gear. And comment below, wet, wait, wipe. That tells me you made it to the end, and that you will never look at rodent cleanup the same way again. Next time, we are covering another infection that can look like just the flu, but may attack the liver, kidneys, and lungs after exposure to water, soil, or animal urine. You do not want to miss that one. Thank you for watching.